Hi, welcome back to Dr. Wellner's Breast Wellness. Today we're going to talk about the self-breast exam. And first, let me be clear, the self-breast exam is different from the clinical breast exam. Not by a lot, but I just want to explain the nuance. The self-breast exam is just as it sounds. You are doing your own exam on your own breasts. Whereas a clinical breast exam is a qualified physician or health practitioner that is performing a breast exam on you. These exams are going to feel and look very, very similar to one another. There's really not much difference, but I'll explain why they are different in a more global perspective. Most breast societies and cancer societies have found that self-breast exam does not actually enhance survival on a population statistics scale. All that being said, anecdotally and in my personal opinion, I have actually had patients find their own cancers by doing self-breast exam. So I actually endorse it. I think there is nothing wrong with it. I do believe that it's important to get to know your breast because you may be the first to discover some difference in your breast. To begin the breast exam, now understand I'm fully clothed and I'm gonna stay that way for the purposes of decency and what we're trying to do here. The first thing you wanna do is stand in front of the mirror. Now you are going to be unclothed. There should be nothing that you're wearing whatsoever. And you wanna focus on your breast area, okay? And the first thing you wanna do is raise your arms like this. Look at your breast while you're doing this. See if there's any dimpling, changes, redness, spots, anything that might seem abnormal. And then come back down and do the same thing, same exercise. Look at your breast, see if you feel like something's being tethered somewhere. It's hard to describe, but you'll know the difference when you see it or feel it. The next thing you want to do is take your arms and form a curvature in your spine like this, so your breasts kind of indent inwards. Same thing, you're looking for those dimpling, marks, lumps, redness, anything that may appear different. That's followed immediately by pulling your shoulders back and really throwing your chest forward and looking again for the same things. So that is essentially the part of your breast exam where you're looking at your breast. The next part is the examination of your underarms or axilla. So you'll take your right hand and you will try to almost painfully feel under your left arm, as deep as you can. And you want to do the same thing on the other side. You want to keep your hand hanging loose so you can get up as deeply as you can. This is a caveat. We all have lymph nodes. So it's possible that you might feel a lymph node. Don't freak out. Most of them are normal, especially in a woman who has less body fat in this region. She will feel that, or he will feel that. Don't forget, men can sometimes get breast cancer too. So those lymph nodes that may be normal can be palpable or feelable. So again, just to kind of attune you into that fact. However, big, immobile, sort of very, very lumpy, something that feels unusual or different, you want to bring to your doctor's attention. So that's the standing portion of the breast exam. Now I want to talk to you about the lying down portion of your breast exam. And this, as you can see, is a model of a breast, okay? And how you want to go about palpating the exam. Now, I have the advantage right now of having both hands, so that's more of a clinical breast exam. And if you do this on yourself, you only have one hand, but you're basically going to be doing the same thing. So what you want to do is pretend these are like spokes of a wheel, like a bicycle wheel. So the first thing you do is kind of like this. You palpate very, very carefully, a little deeply, maybe a little tender, the outside circle of your breast. And then you start like concentric circles going further and further in to the breast. Now the breast usually gets a little bit thicker and bigger, so you want to press a little harder when you get to that. You're also looking at the breast for any changes, any skin, what looks like eczema here, anything else, any redness. And then when you get to, this is called the NAC, or the nipple areolar complex. And when you get to the nipple, you want to squeeze kind of like that. Okay, so you add pressure to see if there's any nipple discharge. Okay. And that's essentially the complete breast exam. If you have one hand, you're going to just kind of do it like that. Okay, so same idea, but you're doing it on yourself, so you only have one hand. And then, of course, rinse, wash, repeat on the other side. And that's essentially the complete breast exam. So that's my segment on both the self breast exam and the clinical breast exam, which you want to do starting in your late 20s every year. Go see your OBGYN, your internal medicine doctor, your nurse practitioner, and make sure he or she performs that exam on you starting at that age. That is recommended by the societies. And again, like I said, really there's not really much harm that can be done by a self breast exam, and every once in a while you will pick up something. It's not that common, but you will, and it could save your life. So thanks for tuning in today. I'll see you guys real soon.